Welcome back to Inside Healthcare. If you or your loved one are among the thousands of Minnesotans who struggle with hearing loss, a cochlear implant might help. Cochlear implants, as you've heard on this show many times, help individuals with moderate to severe hearing loss who have not had success with traditional hearing aids. You can find out more about cochlear implants at a free informational seminar led by Health East audiologist Dr. Stephanie Lepke. The seminar will be held on Saturday, May 17th at 10 a.m. at the Health East Midway Clinic at 1390 University Avenue in St. Paul. It's right next to the Herberger store. You can register online or call 1-877-432-7844. Again, it's 1-877-432-7844. And if you just need some information, you can call the clinic at 651-232-0707. That's 651-232-0707. Now we turn our attention to one of the most common reasons for healthcare visits. That's low back pain. Did you know that it becomes more of a common problem as people age, affecting more than half of the people over the age of 60? If you're one of them, there's a new non-surgery therapy that might help ease your low back or neck pain. And we're very pleased to have with us Erin Dykeson. She's a psychotherapist with the Healthy Spine Center. Thank you for being with us, and I hope I didn't murder your last name too badly there.
Not too bad at all.
So
Thanks.
it begs the question, how does psychotherapy help reduce physical back and neck pain?
Sure. Well, what we've found is that the way that you think about your pain, the amount of stress that you have about the pain, about your condition, can really affect how much you feel the pain.
So it's not just a physical thing, pain. It's actually something that's...
Yeah, I mean, your mind
body.
and body are connected, and your spine leads right up into your mind. So it's... If, for example, if someone is just feeling very stressed out about their pain, they're going to have more tension in their body. And when you have more tension in your body, you're going to increase your pain. So what I do with...
that all makes sense, yeah.
So what I do with the patients that come into my office are, we look at sources of stress in their lives, coping skills that they do have, working on increasing those, teaching relaxation techniques like guided meditation, deep breathing exercises.
I love deep breathing. I find that so stress relieving.
Yeah, you know, it actually resets your nervous system. It has very concrete, like physiological effects where your blood pressure decreases and you just feel calmer, heart rate will even out, and it's really, really good for you.
So you're still going to have the source of that pain, whether it's your low back or your neck, but you're going to feel better using some of these techniques?
Yeah, you're going to feel better, and you may be able to reduce some of your reliance on painkillers, like
really,
Dr. Franz was talking about. Yeah, absolutely. Learning how to also incorporate pleasurable activities into your life can help a lot with your mood. Find that people who have pain tend to get depressed. And part of this is because you're not doing the things you used to like to do. So if you can start incorporating some of the things you used to like to do to the extent to which your physical limitations will allow, you can feel better, your mood will improve, and when you're happier, you're not focused so much on the negative things in your life, like your pain.
I know personally when I exercise, you know, nothing can bother me that day, you know, after a good workout and stuff. You just feel really good. So what would be some of those things that you mentioned briefly about imagery and things like that? What would be some other things, like, for example, if someone comes to you and they've got tremendous low back pain?
Yeah.
How do you help them?
Well, a lot of what I deal with is the emotional impact of that. And the main tool that I use is cognitive behavioral therapy. This is a form of psychotherapy that came about in the 60s based on behavioral research. There have been many waves of it throughout the years, and more focused on some mindfulness techniques now. But what it is that we all have thoughts, we have feelings, and we have behaviors. And all of these interact with each other. So if you can change one part of that equation, you can change the others. So the easiest thing to work on are the thoughts and the behaviors. because you can't say to someone, just be happy,
Yeah.
and that won't work. But if you can change the way someone's thinking about their pain, about themselves as a person, then you can change the way that their mood is, and then your mood lifts, you worry less, and your pain becomes less of a central focus in your life.
Do you have an example of a patient or a couple of patients that come to mind that how it worked for them?
Yeah. I have been seeing one patient. She's a mom of 2 kids, and she came to me and she was just feeling really bad about herself because she can't do all the things that she used to do, and for her kids, and that sometimes she gets a little irritable because the pain gets really intense. And what we did was really look at the ways in which she is still a great mom to her kids, and she is. And helping her realize that has made her just focus more on what she can do rather than what she can't do, and has improved her mood tremendously.
I understand that you're going to be starting a psychotherapy group, a support group? Not support group, but a group, a psychotherapy group.
Yeah,
What is that
exactly.
about?
Well, it's called Rethinking Pain, and I'm really excited to get started because it's teaching how to think about your pain differently. So how to take it from looking at it as a threat to looking at it as a challenge, and looking at it as a chance to show strength, and also how to gain support from others in your life through a good assertive communication, number of other things like the relaxation, looking at people's beliefs about pain. Because if you have beliefs that your pain means that there is absolutely something wrong with you, when sometimes that's not necessarily the case. You're feeling the pain, but it doesn't mean that something bad is going to happen. But if you keep looking at it like it's a catastrophe, then you won't be able to move past it. So what we do is we'll be looking at the thoughts that people have, their automatic thoughts about the pain, and looking at how to change those and how to create new automatic thoughts, like the pain will pass. I have good days, I have bad days.
What's the advantage to having other people be involved in this as opposed to one-on-one type therapy?
It's so good because, if you have a friend who's in a situation similar to you, and you can think of an answer for them pretty easily, right? But when you're thinking about yourself, it's a little harder. So by having a bunch of people who are going through similar things, you're actually teaching while you're learning. So someone else in the group may have had an experience very similar to you, and they can say like, oh, hey, you should have tried that. And then you think, oh, well, I guess I should take my own advice.
I can see that. So when are the classes? When will they be meeting, and how does someone find out more about it?
Yeah, it'll be Tuesday mornings from 9 to 10:30. It'll be at the Healthy Spine Center. So the way that you would get involved with that is to come and see one of the doctors at the Spine Center, because we all work in an integrated model. So that means that you see the medical doctors, you work with physical therapy, you work with chiropractic, you work with any of the number of other interventions that we have.
More holistic type
Exactly.
approach to treating back pain,
Yeah.
and neck pain.
Yeah, exactly. And then my services are just part of that whole approach. So you come in and see the doctor and tell them that, well, I'd really like to work on the way that I think about my pain too, and learn some stress relieving techniques as well.
So if someone's watching this, do they need, you mentioned working with the others at the Spine Center, but do they need a referral to come see you, and does insurance cover this?
Insurance does cover psychotherapy, but of course people would want to check with their individual plans to make sure that we're in network for them, and that the specific services are covered. But they would need to see one of the doctors at the Spine Center first. To have that full evaluation and come up with the plan.
So if they wanted more information, how do they go about doing that?
Just call the Spine Center and tell them what's going on and get an appointment, and we'll go from there.
Well, Erin, it's been a pleasure to have you with us. Great information, too.
Well, thank you so much.
Any final comments for our viewers?
I think it's just so important to look at the at the mind-body connection in any kind of illness, because it's all related. It's not, there's no separation really. So
Yeah,
just to be
it's
mindful
total
of
mindset change,
yeah.
isn't it?
Yeah, it really is. It's an exciting change in healthcare that's been happening recently. So.
Well, again, thank you, Erin, for being with us. Appreciate it.
Well, thank you.
And we'd like to thank you for joining us. We hope you join us again next time here on Inside Healthcare. We'll see you then, everyone.